Now, moving on to the next modality in which you might actually want to employ if you are trying to do if you are trying to diagnose and actually screen medical conditions in gynecology and obstetrics. This is what is known as the STI screening. All right, STI screening. So this is sexually transmitted infections. All right, sexually transmitted infections screening. So so it's just a critical component of preventive care. So of course, if I'm screening, it's not because I have the disease condition. It could be that I have the disease condition, but I want to actually dictate it early. Do you understand? So I'm always coming to the hospital so that my system is being checked upon, so that if there's any future disease condition, it can also be dictated. So it helps to dictate infections early, prevent them from actually going into complications. Sorry, I think I didn't get the right color. Then it can help to protect individuals and the public health, especially during pregnancy, when certain infections can actually affect the development of the baby. Okay, so for the various infections that you might actually want to screen for in gynecology and obstetrics, because we are focusing on women issues, it could be chlamydia and gonorrhea infections. So you can look at the screening method. You can actually look at why the screening matters. It could be HIV, where you are looking at the screening method, why it matters. It could be syphilis, it could be hepatitis B or C, it could be human papilloma virus. Of course, that one you want to check out for what? Cervical cancer. Then it could be trichomoniasis. That's all those vaginal bacterial infections, okay, that gives it the fishy smell. All right, so these are the common STIs screened in obstetrics and gynecology. So who should be screened? So if a woman is sexually active, right, under 25, women with new or multiple partners, pregnant women, because you don't want any infection that will come and complicate the fetus, then high risk individuals, that's like more frequently testing for HIVs and hepatitis C. So STI screenings in pregnancies is essential to prevent the infection spreading to the baby. That's what we call the vertical transmission. You want to avoid any complications that will come up in a pregnancy. Then you want to ensure that the delivery, okay, will be very much more safe. All right, so this is it for these STI screenings in gynecology and obstetrics.